So this is a connective tissue type 2 part 2 tutorial presented by the SchrDbb. Reference Atlas of Histology and Function and Clinical Correlation by Dongmei Cui. So for connective tissue, we are going to continue here with the types of connective tissue. The types of connective tissue, we have connective tissue proper, and we have specialized connective tissue, and we have embryonic connective tissue. So for the connective tissue proper, we are going to have the dense irregular connective tissue. We have the dense regular connective tissue, and we have the loose connective tissue. So that is for the dense connective tissue is dense irregular and dense regular, and this is the loose connective tissue. This is just it takes different representation, both histological and schematic representation. Now for the specialized connective tissue, we have adipose connective tissue, then we have reticular connective tissue, and we have elastic connective tissue. These are the representation, both histologic and schematic. And then the last one is embryonic connective tissue, which is divided into mesenchymal connective tissue and mucous connective tissue, their histology representation. So I'm not going to speak in much more on the classification. If you want to see the different classification and then the characteristic of the tissues of each of them, you can just make a pause on it and then you visualize it. Now, the next thing that you're going to see is the dense irregular connective tissue. So for dense irregular connective tissue, you need to know that what example of a space where you have dense irregular connective tissue is a mammary gland. So here we are going to have collagen fibers. These are collagen fibers, and then they are fibroblasts. In dense irregular connective tissue can be found in the mammary gland. That's the first point. Here you are going to have collagen fiber is a fiber that, because when you want to speak about the connective tissue, I've said that there are three elements that you have to speak about. You must speak about the cell, you must speak about the fibers, you must speak about the ground substance. Here the cell that predominates is going to be fibroblast. The second thing is that the collagen fiber that predominates is the fiber that predominates is the collagen fiber that predominates. Now the specific characteristic of dense irregular connective tissue is that it's going to have a wavy movement, so a wavy appearance of collagen fibers. So the collagen fibers are not in a regular pattern, they're in a wavy appearance, like a wave. You see it is going up, it's going down, it's coming, it's going up, it's going down, like that. So that's dense irregular connective tissue. We see a wavy appearance. Occasionally dense irregular connective tissue can also be found in blood vessels, and mostly the blood vessels where they are found is not large elastic arches, but instead they are going to be found in small arches, so small muscular arches where they can have a dense irregular connective tissue. The next thing is dense irregular connective tissue at the dermis of the skin. So in dense irregular connective tissue, in the dermis of the skin, you still have the same representation, but here you can have more elastic fibers, because that's why your skin is a little elastic, and try to pinch your skin and find its some level of elasticity. That's because of the elastic fiber that's also found there. But here you still have a wavy appearance of collagen fibers. It's not having that irregular appearance. That's a wavy appearance. This is a gland, you can see wavy appearance. So in order to identify the collagen fiber, you see that when you use hematoxylin and eosin stain, you cannot easily identify the elastic fibers. Is it clear? So that's why you mostly see collagen fibers pinkish. Now you can visualize easily elastic fiber when you use the elastic stain, and when using the elastic stain, you're going to see that the elastic fiber are going to be dark color. Now the clinical correlation of the dense irregular connective tissue of the skin is going to be actinic keratosis. Actinic keratosis, also called a solar elastosis, is a degenerative skin condition which mainly affects the collagen and elastic fiber of the skin due to sunlight or ultraviolet exposure. So that's a genetic condition. So it can be a pre-malignant, considered a pre-malignant lesion. So how are you going to visualize now this on a histopathologic view? So you visualize that on a histopathologic view by having connective tissue are going to become loose. You have degeneration of connective tissue, so you have blunting of connective tissue. You don't see any connective tissue, and you also have dermal atrophy. So the dermis become atrophied. So the dermis become atrophied. Why? Because you have the lack of the connective tissue. So you have the lack of connective tissue. The connective tissue disappear. That the collagen fiber disappear, and also the elastic fiber predominate more than the collagen fiber. That's why you have more of wrinkles on the face. So the skin is not much more attached again as before. The collagen fiber now depreciate, and then the elastic fiber increase more in amount than the collagen fibers. That's why you have wrinkles on the face. Your skin become much more elastic and all that. Now the next one is dense irregular connective tissue. You have already seen that, but now this is dense irregular connective tissue of thin skin. So this is the collagen fiber, this is the dense irregular connective tissue here. So malfunctioning of the collagen fiber can cause a series of connective tissue disease, which is called Ehlers-Danlos syndrome. The main connective tissue disease is Ehlers-Danlos syndrome, which is overproduction of collagen in the dermis of the skin. Why overproduction? If it is malfunction, is going to result to Ehlers-Danlos syndrome and other syndromes that you have seen in the table above. And if it is due to overproduction of the skin in the dermis, it may produce hypertrophic scar or keloids. Now, clinical correlation, hypertrophic scar or keloids. What are hypertrophic scar or keloids? Hypertrophic scar is just a scar, is overproduction of connective tissue on a wound site, but it does not exceed the borders of the wound. So you have excessive scar on the wound site, on the site of a wound, but it does not exceed the borders of the wound. That's for hypertrophic scar. While a keloid is going to exceed the borders of a wound. So how can you visualize now hypertrophic scar or keloids now on histopathologic view? Histological view, you have thick collagen bands. You are going to see thick collagen band, and you are going to have increased fibroblasts than before. So we have thick collagen band, and you have increased fibroblasts than a normal histologic section of that of a dense irregular connective tissue of the skin. The next thing to visualize now is going to be dense regular connective tissue. As you can see, dense regular connective tissue has collagen bundles which are oriented into a parallel cylinder. You can see they are parallel, they are not wavy, going up and down, they are parallel in direction. An example of places where it can be found is the tendon. They are parallel. So this is a dense regular connective tissue. See, the fibroblasts are also aligned in a particular direction, parallel direction. Here down here is at the ground substance. So here you can see this is a representation of dense regular connective tissue. This with the ground substance here, and this is the collagen fiber, and then this is the fibroblast. Now the clinical correlation now of this is tendinosis. What is tendinosis? Tendinosis is a degenerative disease that occurs within a substance of the tendon. So degenerative disease of the tendon. This condition usually associated with age, overextension of both or of the hand. So example, when you do tennis, you may have tendinosis, degeneration of the tendon, and that degeneration of the tendon may easily result to a rupture. Now, what can you visualize? You can visualize here. So on the histologic section of a tendinosis, you can have excess fibroblasts. Normally the fibroblasts should not be excess like that. So you have excess fibroblasts in tendinosis. You have collagen micro tears. On the collagen fibers are going to be torn. Some collagen fibers are there. So you have collagen micro tear. You have increased mucoid ground substance. Ground substance is going to increase in amount. You have calcification, and you have proliferated blood vessels. So those are the elements involved in tendinosis. Excess fibroblasts. You have collagen mycote, you have increased mucoid count substance, you have calcification, you have proliferated blood vessels. Now the next thing to visualize now is a loose connective tissue. So this is going to be located at the level of the mesentery. Here we have used a Verhoef stain. So with the Verhoef stain, you can see elastic fibers, thin fiber, and then collagen fibers, thick fibers here. So loose connective tissue, you have mostly all the space here is white, which you can see much of the ground substance. That's what you think of loose connective tissue. And in loose connective tissue, you can see many cell types inside. So that is for loose connective tissue. We have both collagen and elastic fiber, which can be seen in the same proportion. The fibers is both collagen and elastic fiber in same proportion, and you can see many cell types inside. Now, loose connective tissue of the large intestine. So loose connective tissue, this is the gut epithelium, and this is the loose connective tissue like at the gut intestine. You can see many cell types. You can also see some fibers inside, but for gut epithelium is many cell types that you can see also in the loose connective tissue. You have some elastic fiber and you have collagen fiber that can be seen. Now, loose connective tissue of small intestine. This is a loose connective tissue of small intestine here. You can see connective tissue cells, and these are the collagen fibers and all that, which can increase magnification. Now, the next thing that you have now, this is a diagrammatic representation of this. Diagrammatic representation, you can see the cells. The cell may have plasma cells, fibroblasts, you may have mast cells, you may have macrophages, collagen fibers, and all that. Now, the clinical correlation of loose connective tissue of small intestine is a Whipple's disease. What is Whipple's disease? It is a multisystemic disease caused by an infection of Bacillus Whipplei. Multisystemic disease caused by infection with the Bacillus Whipplei. So it is primarily affecting the small intestine. Though it is multisystemic, it is much more affecting first the small intestine. Now, what is the histologic view of that? Histologic view of Whipple's disease. Histologic view, you are going to have inflammatory neutrophils. Normally, there is no neutrophil inside the dense irregular connective tissue of the normal dense irregular connective tissue of the normal loose connective tissue of the small intestine. There is no neutrophils. But when you start seeing neutrophils, just know that there is an inflammation that occurs. Now, for Whipple's disease, you may see also lymphocytes, many lymphocytes inside, but these lymphocytes are not as can be present inside the loose connective tissue, but not in much amount. But when they are present in much amount, you know that there is inflammation. And the last one, you have active macrophages. So this one is not typical of Whipple's disease. It's just showing that there is an inflammation of the lung mucosa. So in order for you to specify that it's Whipple's disease, you have to see the Whipplei organism inside the macrophages. You may see them, there are structures of this bacteria inside the macrophages. The next thing, we have type of connective tissue. This now we have now going into specialized connective tissue. So specialized connective tissue may have adipose connective tissue. Adipose connective tissue, as you can see here, these are adipose connective tissue. It is much more made up of adipocyte cells. You may have also fibers. So as you can see here, you have so some fibers which are around here, which are made up of dense, which are made up of collagen fiber and some elastic fiber. So now we need to know that what. So adipose tissue can be divided into white adipose tissue and brown adipose tissue. White adipose tissue, it is made up of, it is actually whitish in color, and it is much more going to be found in human beings. So, and then dark brown adipose tissue, it is unilocular. Unilocular means that it's only unilocular, that white adipose tissue. Basically, it contains a single large lipid droplet in the cytoplasm. That is white adipose tissue. It is whitish and has a single large lipid droplet in the cytoplasm, unilocular. While in brown adipose tissue, it is multilocular adipocyte. That is, it has many multiple large adipose, multiple large lipid droplets inside. Basically. and it is much more located, much more found in hibernating mammals and newborn infants and also the fetus. But in case of adults, children, you already have white adipose. Now this is the diagrammatic representation of that with many adipocytes. You have the reticular fibers, you have collagen fibers, as you can see. Now clinical correlation is obesity. Obesity is just when your BMI is greater than 30 kilogram per meter square. That's the definition of obesity. Obesity can be genetic or can also be environmental. So in order to visualize obesity now on histopathology, on histologic view, you have large adipocyte, that's expanded adipocyte containing huge lipid droplets, and you have collagen fiber pushed to the inside. You may not even see collagen fibers. Now, reticular connective tissue. How do you visualize reticular connective tissue? Reticular connective tissue is a specialized loose connective tissue that provides a delicate supporting framework for many high connective tissues such as endocrine glands. So it is mostly involved with supporting framework. It contains the reticular fibers. In reticular connective tissue contain reticular fibers, and in this case you have taken it from pancreatic cells. That's pancreas. You have taken it from a pancreas, so you are going to see pancreatic cells which are located, which are going to be seen in this glandular aspect. You have acini which are surrounding a particular tubule. Now the next one, we have reticular connective tissue still with the silver stain inside for the liver. So the liver, you need to know that what you have reticular fiber that can be seen in that. The liver cells are hepatocyte, they are hexagonal shape. So we have hexagonal shape and they are going to produce sinusoids. You can see sinusoids here, different sinusoids can be seen inside the liver with the hepatocyte. So all that. Now the clinical correlation of reticular fibers location inside the liver is going to be liver cirrhosis, and the definition of liver cirrhosis is a liver disorder caused by the chronic injury to hepatic parenchyma. Here is a fibrosis. So cirrhosis is just referred as fibrosis of the liver, which is much more irreversible, though sometimes based on the level of the cirrhosis it may be reversible. So that is just the fibrosis of the liver, where the parenchyma of the liver is replaced by connective tissue. So that is going to be identified as that. Now, how do you see the cirrhosis now on histology? The nodules regenerate, or the nodules of regenerated liver cells. You see, the liver cells are not more appearing in their normal parallel aspect. Normally, the liver cells should appear in the parallel aspect, and then you should see sinusoid as seen here. But when you don't see again the sinusoid are disappeared. The sinusoid disappear. Now you see the liver cells appearing in nodules like that, because they are regenerating in one particular part. That is going to be for liver cirrhosis. The next thing is the collagen bundles and elastic fiber have replaced the normal reticular system. Normally they should be a reticular system, but when you start, and you should not see collagen bundle and elastic fibers, because that should not be found inside the liver. When you see now collagen fibers and elastic fiber, it means that there is fibrosis inside the liver, and that is typical of liver cirrhosis. And then the last one, you have damage or reduced reticular fibers also present. The next thing is the elastic connective tissue. Elastic connective tissue can also be present in large arteries, like can be present in elastic arteries like the carotid artery. When you use the elastic stain, you can see elastic lamina. You have to see that what in elastic connective tissues. In elastic connective tissue, you need to know that what as you have seen before, in dense connective tissues, loose connective tissue, there were elastic fiber, but the particularity of elastic connective tissue is that the elastic fibers are going to be arranged in elastic lamina, as you can see here. You have elastic lamina, as you can see. So this is the particularity of elastic connective tissue, that the elastic fiber are going to be arranged in elastic lamina in the histology section. Now in the representation, diagrammatic representation, you can see this with smooth muscles. You have collagen fiber, elastic lamina, and all that. Now, the clinical correlation of the elastic connective tissue is Marfan syndrome, and Marfan syndrome is a cystic medial degeneration. Here, Marfan syndrome is an autosomal dominant disorder which is caused by mutation of the FBN1 gene mutation. So, it's a mutation of the FBN1 gene mutation. So, what is FBN1? FBN1 is just fibrillin gene. So, FBN is fibrillin. So fibrillin 1 gene mutation that's going to produce autosomal dominant, going to produce Marfan syndrome, and that Marfan syndrome is going to affect the aorta, anything that contains elastic connective tissue, that's the aorta, the heart, the eye, the skin, anything that contains the elastic connective tissue is going to be affected. Is it clear? Now on the histologic view now of Marfan syndrome, you have loss of the elastic laminae. So there's a problem. There is loss of elastic laminae. There is increased ground substance. You have loss of elastic laminae. You have increased ground substance. You have fragmentation of elastic laminae, just like fragmentation of elastic laminae, just as the clinical correlation that was seen above there. And then the last one is a cystic space fluid with amorphous extracellular matrix. You have cystic space fluid. So we have loss of elastic laminae and increased ground substance. We have fragmentation of elastic laminae. The next thing now is the embryonic connective tissue. For the embryonic connective tissue is divided into mesenchymal connective tissue and then mucous connective tissue. A mesenchymal connective tissue is found in developing structure of the embryo, and it contains reticular and mesenchymal, reticular fibers and mesenchymal cells. So there you also have now things differentiate that they are going to differentiate into the cartilage, the bone, embryonic red blood cells. Those are the very typical things of mesenchymal embryonic connective tissue. So you can see mesenchymal cells as such here, see mesenchymal cells, and these are embryonic red blood cells that you can see also in this section. The next one is the mucous connective tissue. Mucous connective tissue is the one that lines now the Wharton's jelly of the umbilical cord. So it is made up, so mucous connective tissue is it has a jelly-like matrix. You can see jelly-like matrix. So you have an abundant jelly-like matrix, like jelly, like matrix. So the collagen, so you have fine aggregates. So here you have collagen fibers. You can see collagen fiber. You can see also fibroblasts inside, and beneath it we have smooth muscles. We have fibroblasts that can be seen, and then here the stain that has been used is the Toluidine blue stain. That same stain that was used in case of mast cells when you want to visualize mast cells. So this is it. So this is a section of a water that shows a Wharton, so it's referred as Wharton jelly. This tissue is referred to as Wharton jelly of the umbilical cord. So the next one now is so you need to know that the elements which are found inside this the matrix is made up of hyaluronic acid. You have so these are the jelly-like mucins. You have jelly-like mucin. So the Toluidine blue is used to reveal jelly-like mucin. So and that jelly-like mucin now contain hyaluronic acid and glycoprotein, which are found inside the matrix of the mucous connective tissue. So this is the summary now of all the connective tissue. So we have connective tissue proper. Generally, the connective tissue is divided into connective tissue proper and specialized connective tissue. In order for you to know the specific findings, you have the connective tissue cell, connective tissue fiber, organization of the fiber, main location, main function. You can now read through all these elements in order for you to visualize their function, the specific location of each connective tissue. So you start pausing now, you read all the elements of each connective tissue. I will say thanks for your kind attention. Let's go to the next tutorial. Thank you.